But I think there are some real challenges along the way in doing that. I think there are a number of challenges experienced through the creation of the work, which I think are really important to mention. One of the challenges is that organisations who are used to managing things internally and used to being able to control the situation find it very uncomfortable to pass that power and control out. One of the fundamental principles of engaging community Staffordshire is that it is outside of the systems. They can't control it.
Yeah, they can't massage
They can't massage it, they can't control it, it exists in its own right. Now, in reality, what that means is that there's lots of meetings where people go, this is a really good idea, absolutely, we've got to do this, this is fantastic, we must do this, but actually...
Then go away and do nothing.
Then go away and go, really don't want this to happen, I'm not sure what I think about this, this is, wouldn't it be better if we just didn't do it like this, wouldn't it be better if we, had our own team of people. We've already got our own team of people doing this. Why do we need to be doing, why do we need to have somebody else doing it? Why do we need to have this new organisation doing it when we can do a perfectly good job ourselves? So actually the situation of moving power from within the organisations to outside of the organisations was one of huge struggle. And I think it's something which is underestimated as across the country now Health Watch organisations are being set up. Health Watch is a piece of policy created through the Health and Social Care Act, and they are about to become operational on the 1st of April. And to a certain extent they're modelled on some of the work done in Staffordshire. So they will exist as social enterprises, they will undertake functions which are about talking to people, engaging with people, using that information to turn it into evidence and insight to make that impact. So it's the same kind of model. But I think there is a huge potential for underestimating how easy that is to say and how difficult that is to actually achieve. Probably the best example would be that in the period of time working up in Staffordshire, quite a constructive meeting, mixed stakeholders, people there from the organisations and the Primary Care Trust and others, which we're talking about the new organisation and how it's going to exist in its own right and what it'll actually do, what its business will be. And so somebody says, oh, I've got it. What we're talking about here is a data warehouse. And for me that encapsulates a huge risk in that the system finds people and the complexity of people's stories and the passion and the emotion of that very, very difficult to handle.
And actually what you envisage is something more dynamic, isn't it? Something that has
a data warehouse.
Yes, there's a life. Yes. It's not simply kind of look at the numbers, it's more than that. Yeah,
and in a way that comment inferred that what one would really like in the system is that there's almost an acceptance that yes, the difficult stuff needs to go on. I've seen that now. That if you don't allow the difficult stuff to enter the system and you don't take it on board, really bad stuff happens. But I don't really want to have to get my hands dirty doing it. So if you could just set up this thing that will take all of the passion and the drive and the emotion, but if you could just turn it into some data, say that when we're ready, we come to the warehouse and we can take our bit of data off the shelf, that would be great. And so there's this disconnection between the passion and how you turn that passion into something that operational managers, senior leaders, strategic decision makers, commissioners, whatever they are, how do you take that raw experience, retain what's real and meaningful about it, but present that in such a way whereby people can use it?
It's dealing with people rather than systems, isn't it?
It is, and I think the challenge, and I don't know if I'm not saying the answer is there yet, but the challenge is where those things meet in the middle. At the moment, there is a disconnection, and I don't think it's yet resolved. I think the disconnection still exists, despite the many hours and the many millions of pounds spent on the public inquiry, which I think has been a good exercise because it has meant that this awful situation is not lost and is being dealt with. But there is still no answer to how you bring the two things together. And at the moment, they're still disconnected, they're disjointed. You have this kind of volcano of passion and emotion and anger, quite rightly, on one side, and then you have these organisations who operate through flow charts and tables and red, amber, greens and Prince 2 project management and Gantt charts, and it's about how you can translate the language of people in a way where it can be understood, or the other way, how you can take the way that the management and the systems have become organised and make that more able to be penetrated by people.
Yeah.
And what people are thinking and feeling. And we're not quite there yet. I hope that an organisation like Engaging Community Staffordshire can help to bridge the gap. So if there was one objective for me out of the creation of Engaging Community Staffordshire, it's to create an organisation that can be at that point of translation, to sit in the eye of the storm and to be able to operate always for the patient and the person and the public and the carer and the family and all of those, but to be able to work with the decision makers, to act as that bridge, to take the information and to help it be heard in the system. Whereas at the moment, I think what we're finding ourselves is this consistency, is smashing into each other. And actually what there is if you take the situation that's been in the media, what you have is these two opposing sides. And they're having a very public fight. And that's, I'm sure, very necessary. I don't see any other way than having that very public fight. But I suppose as a practical,
But something has to change over time, doesn't it?
I hope that you can't carry on.
You can't live in a public fight forever.
No, because it takes up the energy and it takes the resource, and the time and the passion becomes in the fight. And I think that we have to find a way
through mechanisms
through that.
Yeah. Jessie, thanks for talking to me today.
It's a pleasure.